4 days after being sworn in as the governor for Embu County, Governor Cecily Mbarire has hit the ground running by inspecting the main health facility, Embu Level 5 Hospital. Mbarire came face to face with the deplorable state of the facility that was just a shadow of its former glory.
We've come to check the challenges that are here because we've been hearing a lot of hue and cry. And as I said in my speech yesterday, the biggest, single largest challenge facing Embu County right now is the health sector. We are glad that we were able to have a chance to also speak to patients who we found either waiting for treatment, or some had come to see patients who are already hospitalized.
She lamented the poor state of the affairs in the facility, ranging from the acute shortage of drugs, beddings and foodstuffs, all of which she said was attributable to poor funding, mismanagement and corruption.
And the one biggest challenge that is there in this hospital is they said they don't have food to give to the patients. It's not enough, and they have pending bills from suppliers, so they don't have anyone willing to supply the hospital with anything to eat. So there was that concern that I had from people coming to visit their inpatient, their patients who are hospitalized.
Another challenge she pointed out was lack of adequate beddings, forcing relatives coming to see the patients to carry along with them bed sheets and blankets.
The second thing that was a major concern when we visited the wards is the linen. There ain't enough linen in the hospital. Some of the women who came to see their sick family members told us they have had to bring blankets to the hospital because there is not enough linen. And even when we visited the wards, you could see that a bed cover is what is being used as the thickest blanket. And so there's that challenge. And we've also it's clear there are no drugs. There's in short supply. There's no in the theater. There are certain consumables that are lacking, certain equipments that have either been procured, have not been fully paid for, so they are not being used in full. And then we've also gone to the kitchen. Big problem there also that needs to be done.
Governor said they were determined to turn around the health sector with 100 days to elevate the suffered patients who had been forced to seek treatment in private hospitals or outside the county.
We are going to deal with the cartels if there are any. There will be no sacred cows. We are not going to leave any stone unturned. We are keen to make sure that the people of Embu County get full services in this hospital. Having talked to a few of the people I've met who had come either to see their patients or coming for treatment, there's desperation amongst the people. So clearly, to turn that around means that anyone in the path of that happening will have to allow us to do it. Because we must give services to the people of Embu County.
Mbarire was accompanied by her deputy Kinyua Mugo, who sent a stern warning to drug theft syndicate that has been associated with the facility.
But we also saying that kama mtu atacheza katika hiyo space yetu na tumeanza kusonga, afadhali ajitoe mapema. Ajitoe mapema tu kwa sababu tunakuja. Maneno ya corruption na cartels. Hata watu wengine wamekuwa wakifanya biashara hapa. Inaitwa air what? The supply air. Unasikia kwanza you call them non-pharmaceutical items. Ile mingi sana kwanza hiyo ndio imekuwa code ya wizi. Na hiyo maneno tunajua. Because you cannot account for injectables, you cannot account for gloves. Unasikia imekuja, unasikia milioni ya pesa imeenda. Those things we have information and we are coming here to enter the rules nut to ensure that mali ya umma, na hiyo hata kama ni shilingi moja ya Kenya, hakuna mali itapotea.
Kwa hivyo hakuna jambo la kusita. Tulisema tunakuja kwenda kazi. Sisi tumeanza kazi. Na baada tu ya kuapishwa, naweza kuhakikishia wakaaji wa Embu, bunge la Embu County litakuwa kitu ya kwanza, kwa sababu tumewitness leo na tumeweza kujionea kwamba katika priorities za Embu level 5 ni mijengo ambayo haisaidii watu wetu. Kwa hivyo kazi yangu ya kwanza itakuwa, Your Excellency, kwenda bunge kutoa pesa ya mijengo na kurudisha kwa madawa, kwa sababu hakuna haja kuendelea kujenga mijengo na kama watu wetu hawana madawa na hawezi pata matibabu. Kwa hivyo wakati tutakuwa tunatengeneza budget ya Embu County through the supplementary, Muhimu ni kwamba tutahakikisha kwamba tumeweza kupigana na ufisadi katika section ya health sector.